Hi, my name's Dr. John Schnorr. I'm one of the co-founding partners of Coastal Fertility Specialists, and I'm excited to be here with you today. I want to talk to you about a very common disorder called Polycystic Ovarian Syndrome, also known as PCOS. Polycystic Ovarian Syndrome is one of the most common causes for patients to have irregular menstrual cycles, and it can be a cause of infertility. Polycystic Ovarian Syndrome is actually not a new disorder. It's a disorder that we've been treating for many years as physicians. It was described early in the 1900s, this disorder, also at that time called Stein and Leventhal syndrome. And it's a disorder that's typically associated with a couple of things. Number one, irregular menstrual cycles, and number two, increased male hormone levels within the female body, specifically the hormones of testosterone. We know that polycystic ovarian syndrome, by definition, is associated with menstrual cycles that are greater than 45 days apart. Most patients with polycystic ovarian syndrome have 1 or 2 menstrual cycles per year. Some don't have any menstrual cycles at all per year. Second thing that's common is to have an increased amount of hair growth on the face, chin, or cheek. Now, it's interesting, when I talk to most women who have infertility or just coming in for a consult, almost all women have a description of increased hair growth on their face. It is common to have some hair growth on the face for women, but what we're really interested in for the diagnosis of polycystic ovarian syndrome is there any problem associated with such bad hair growth that they have dark hair growth that they need to shave significantly for, pluck or do waxing for, that they get sideburns or maybe a lot of hair on their chin and maybe even an early mustache. Those would be things that would be associated with polycystic ovarian syndrome. If a woman has irregular menstrual cycles but really no overt evidence of too much hair growth, what we can then do is measure a woman's total and free testosterone level. That's a male hormone. In women, it's made from the ovaries, and testosterone can be measured to see if it's elevated. Most women with a testosterone level should have a normal level that's less than 50. That's considered normal. Polycystic ovarian syndrome tends to have levels of 75 to 125 in those ranges. Polycystic ovarian syndrome should not be associated with significantly elevated testosterone levels above 125. That's when we start thinking about other disorders other than polycystic ovarian syndrome. Now, a lot of research has been done to figure out what's causing polycystic ovarian syndrome, and the answer appears to be related to insulin. That it turns out that women with polycystic ovarian syndrome have a very high chance of having insulin receptors in their body that are not responsive to normal hormone of insulin. And so it turns out that insulin resistance, your body's inability really to respond well to insulin, causes insulin levels to rise in your body. And as the insulin levels rise in your body, it makes it so that more hormones are made from the ovary called testosterone. And it's that elevation in the testosterone that causes the hair growth, causes problems with irregular menstrual cycles, and can be a cause of infertility. Now, it's noted that about 2/3 of all patients with polycystic ovarian syndrome have weight problems, in that their weight's too high. Some really great studies have now shown us that if a woman with weight problems can lower her body weight by as much as 10%, we get significant improvements in the menstrual cyclicity and the chances of conceiving. And so if you come in with weight problems, we know that a normal body mass index is generally considered 19 to 25. If your body mass index is above 25 to 30, we start thinking that weight could be a part of that problem. And we think that weight's part of the problem through adipocytes, which are fat tissues in our body. They secrete a hormone called leptin, and leptin can be associated with the insulin resistance and other problems. And so weight reduction is the number one step. Now, a lot of patients ask me, how do you lose weight? And unfortunately, it's simple. It means that you have to eat less calories than you burn. I'm not a big fan of any big special diets. I hear people all day long talking about a grapefruit diet and a caveman diet and all these kind of different diets. Well, reality is we need lifestyle changes for you so that your weight's down for the rest of your life. You probably don't want to be on a grapefruit diet for the rest of your life or on a caveman diet for the rest of your life. And so really the answer is eating healthy foods, decreasing fat intake. Remember that fat has 3 times more calories than actually the carbohydrates and protein. So decrease your fat intake, exercise more. Of weight reduction, probably about 75% of weight reduction is caloric restriction and decreasing your calories, and 25% is increasing your exercise. So we'd encourage you to decrease your calories and increase your exercise. For patients with polycystic ovarian syndrome who have infertility, the recommendation is that we look for other causes of infertility to make sure we're not missing anything. So we want to do a hysterosalpingogram, we want to do a semen analysis, we want to measure some of your hormone levels. And with that, we'll know if there's any other causes. And if the only cause is polycystic ovarian syndrome, then what we need to do is to help you ovulate. We want to help you ovulate by helping you lose weight, number one. Number two, there's a medicine called Metformin, also known as glucophage, which can be helpful in lowering your insulin levels in your body and helping you ovulate. We're going to ask you to probably take Metformin. Metformin is a product that you take by mouth. Ideally, we want you to take 1 tablet 3 times per day. It causes some intestinal distress, sometimes some diarrhea and some gas can be associated with metformin use, and it's clearly related to the quality of the diet. The better the foods you are that you eat, the better your diet is, the better you're going to be able to tolerate metformin. Generally keep you on metformin for a couple of months, watch your menstrual cycles. If you start having regular menstrual cycles on metformin, regular menstrual cycles plus regular intercourse should give you a good chance of pregnancy as long as the rest of your testing's normal. If you're on metformin and you don't conceive, we can then add in medicines which will help you make more than 1 egg in your ovary, and then we can wash the sperm and put it into the uterus just around the time of ovulation. And that's called ovulation induction and intrauterine insemination, and gives you a higher chance of pregnancy. For patients who have polycystic ovarian syndrome and conceive, we would then want you to continue your metformin until about 12 weeks of pregnancy, and then we'll send you back to your OB/GYN, and they can help to decide whether or not you should be on it longer. Some women who have weight problems actually benefit by being on metformin throughout the pregnancy because it lowers the risk of gestational diabetes and other problems. So if you have any questions, feel free to give us a call. Polycystic ovarian syndrome is very common, it's very treatable, and I think the first thing is lifestyle intervention, working on the weight reduction, using some diabetic-like medications like metformin and glucophage, and then if necessary, we can give you medicines to make more than 1 egg. Hope you have a great day. Talk to you later. Bye-bye.